We've evolved from an organization that was focused on a few kind of key things that were administrative in nature or logistical in nature to an organization that, whether it's drug pricing or new regulatory stuff from the college or new health policy from pharmacare, they don't need to think about that or worry about that because we've got their back. That's our job, is to cover all of that stuff and let them go to work every day and be pharmacists and focus on the patient.
That ability to be pharmacists couldn't have happened without the work of the BC Pharmacy Association, which all began 50 years ago. 50 years of advocacy, 50 years of expanding the scope of practice, 50 years of filling the gap in healthcare delivery in British Columbia. The purpose now reflects the reason the association was formed.
College of the day was required to administer the Pharmacy Act, and only to a limited degree could they represent the profession where it needed to be represented.
Thus, on May 22, 1968, the British Columbia Professional Pharmacists Society was inaugurated. From humble beginnings, only 685 pharmacists, to today, where membership stands at 3,200 pharmacists and over 900 community pharmacies across BC. Over the next 50 years, the association advocated for pharmacists, provided insurance for pharmacists, and expanded the scope of practice, filling the gap in healthcare in BC.
50 years later, look where we are today.
It's gone from the Stone Age to the Space Age.
During the association's first years, big changes were happening. The government introduced a drug subsidy program, and the association worked towards establishing a payment model for pharmacists.
It was an organization that was looking towards getting some representation and doing something for the pharmacy as a group.
Over the next 2 decades, pharmacare was introduced. We added more insurance benefits for members like malpractice, life, and commercial.
The major advancement that the profession has made was the introduction of PharmaNet in 1995, which provided a complete patient record for every patient in British Columbia. Every prescription got recorded in a central database.
As the government continued advancement in drug coverage and modernization, pharmacy became more involved in helping find solutions for patients and healthcare issues. We worked closely with government, and all the while the association continued to advocate for the economic well-being of pharmacists and to ensure pharmacists were a part of the healthcare solution.
The point of going to government and saying, how can we help you? That is, how can pharmacists be of help to the government, as opposed to going to the government with demands and requests.
When the H1N1 virus hit British Columbia, the demand for injections overwhelmed the healthcare system. Pharmacy was and continues to be the most accessible point of contact in the healthcare system, and it provided an opportunity to inject thousands of patients and at the same time expand the scope of pharmacy practice.
Strategic opportunism. There was a problem out there and you put out your hands and you caught it.
Then came changes that pushed the practice of pharmacy forward and continued expanding the scope of practice.
Pharmacists are now able to provide clinical services and adaptations, and we're hoping for a larger expanded scope of practice.
Prescribing rights on the horizon, or as we were pushing for it, and BCPhA is pushing for it as well.
I think it'd be very difficult to imagine scope of practice changes happen without the association, and as the scope of practice changes, then obviously there's a real need to provide that continuing education.
What I'm really excited about is, as pharmacists gravitate back to a patient care role where they are going to embrace more of their clinical skills. So that level of engagement with a patient where we are the drug experts, optimizing a patient's health outcome by choice of drugs, optimizing drugs.
And now with pharmacy genomics, we can look at individualized pharmacy medicine.
We're now looking forward of what we can do next. I think we have to see how far we can go. Is it full scope? Is it broad reaching? Is it limited? Is it specialized?
As scope of practice continues to expand and will include a range of new procedures, regulations, equipment, and medications, the need for ongoing support will remain.
We want to keep growing and always expanding on our knowledge and not just kind of stick to the same routine.
Over the past 50 years, the association added to, but never wavered from its core mission of advocating and supporting pharmacists. The future is exciting and challenging, and together we will continue to meet the needs of patients in BC.
The future of pharmacy is in really good hands these days.
I think we're at the waterline, right? I really think we've reached that point where we need to do some things differently. And if there was ever a profession that was waiting to be called upon, it's pharmacists.